Okay, let's solve a classic medical mystery, the S4 heart sound. If you've ever put your stethoscope to someone's chest and heard a faint extra thud just before the usual lub-dub, you might have stumbled onto the elusive S4. So what exactly is it? The S4, also known as the atrial gallop, isn't normally heard in healthy adults. It happens right before S1, during late diastole, when the atria contract and push blood into a stiff, non-compliant ventricle. Imagine trying to pour water into a bottle that's already full. It's kind of like that. The result? The heart gives off a low-frequency sound that's S4. Now, if you're thinking, wait, why does this matter? Here's the clinical gold. S4 is almost always a sign that the ventricle isn't relaxing properly. You'll hear it in conditions like left ventricular hypertrophy, hypertension, or after a heart attack, not in young, healthy hearts. So if you catch an S4, think about what's making that ventricle so stiff. Quick tip. S4 is best heard with the bell of your stethoscope at the apex, patient in left lateral decubitus. Remember the timing. S4 comes just before S1, so it's ba-lub-dub, not lub-dub-da. So next time you're listening for heart sounds, keep an ear out for that mysterious extra thud. It's not just noise, it's a clue. And that's what makes clinical medicine so fascinating. Thanks for listening, and don't forget to trust your ears.